Okay, right, we're going to start looking at a different style question today. We've got to look at a 16-mark question. So this one gives you a statement like normal. So it says the treatment of disease and the care of the sick completely changed after 1800. The key message here is completely changed. Okay, essentially it's asking us, after this time period, how did medical care change, or care of the sick change in this period? Okay, so what we have is we've got how far do you agree statement, so you know you need to say agree or disagree, and we know that we need to write 4 paragraphs. Okay, and you know roughly you have about 25 minutes to do so. Okay, so this one's giving you 2 already. It's giving you magic bullet and it's giving you the NHS. Okay, you know this style is point, evidence, explain. The only slight differences is the point. It is possible to agree or disagree. Okay, and then you start going to your evidence and then you explain it. Okay, so add with the statement. Okay, so from that point onwards, okay, it goes evidence like normal, then you can explain it. Okay, we need to see that word where you explain, you see that word because the evidence put, for example, or to my knowledge. Okay, so when we start looking at the magic bullets and the NHS, then we'll start with magic bullets. Okay, because we know magic bullets would treat an illness, disease, while leaving the body unharmed. Okay, the first one was called Salveson 606 and it treated syphilis. Okay, so in your head that's something what you should be thinking about there. So how is that completely changing the treatment or care of the sick? So in your head think about now we can actually cure the body or cure an illness without damaging the body. Okay, so patients are getting better care and better treatment because we actually can cure the body and cure it much more effectively. Okay, so that's like the big change there. So when you're explaining it, think on how it totally changed the care of the sick. Think in your head, right, well we can take this medication like Salveson 606 which totally leaves the body unharmed. And when you go into that little bit of extra detail, think, okay, do we just have Salveson 606 now? Do we have loads of different types of medication which is used to treat a patient without damaging the body? Yes, we do. Okay, the next one is the NHS. Okay, we know that was 1948. The government launched the NHS. Which provided free healthcare. Okay, so we know that's why the NHS is important. When we go into a little bit more detail, we start explaining it. So 1948, the government launched the NHS, which provided free healthcare. Simple. So how is this completely changing the care of the sick? It improved the standard of care in hospitals, and also with that he invested money into developing new medical treatments. Okay, so the next one we're going to talk about is penicillin. So penicillin was the first true antibiotic which would tackle and infection. Okay, so there you go, penicillin, the first true antibiotic which would tackle an infection. Okay, so again, in our head we need to be thinking, how is that treatment of sick and care as well completely changing? Because now we can fight against infection which was one of the biggest killers. Okay, and with that as well, we need to be thinking a little bit more detail here, is that it led to different types of penicillin for different infections. It became more bespoke. Perfect. Okay, so when you look at that answer there, that's your 3 paragraphs. You then need to add your conclusion. In the conclusion, you need to answer the question. Make that final statement. Do you agree or do you disagree with the statement? Okay, it's your choice. Just a quick reference to the mark scheme. Okay, we need to be aiming again for level 3 or level 4 in the mark scheme. I'm going to go pick out some key parts of the mark scheme, okay, which we should all be aiming for. So even if you look at the difference here between level 3 and level 4, look at that phrase, attempted analysis. So when you think about analysis, think about those phrases, this led to, this meant, this resulted in, to really attempt to get into this box here. Okay, coherent, logically sustained, logically structured. But the big one here, judgment is given and explained towards the question. So let me be clear, that is your conclusion. Okay, it needs to be strong, it needs to be developed to get into this one here. It says here, attempt at an explanation towards answering the question, an attempt. Okay, so if you attempt it and the explanation isn't quite there or is not quite developed enough, you'll fall into level 3. The level 4, it needs to be explained and linked towards the question. So in there, I need to see that final response and answer. Okay, so you'll have 25 minutes to do this question. Make sure you set a timer. Okay, make sure you always refer to, if you need to, the plan at the start. Okay, I'll put it a little bit up in case you just need to see it one last time. Okay, but as you're writing up, you have 25 minutes, and that's what you need to do in. Right, good luck, everyone.